Hey, this is Dr. Adam DeFazio. I'm a cosmetic urologist at Miami Men's in Coral Gables, Florida. I think one of my favorite procedures to perform and the things I'm most passionate about is cosmetic circumcision and circumcision revision. And the two really go hand in hand. Um, I think I'm the only person in the country who describes himself as a cosmetic urologist and really sees himself as having a center that specializes in cosmetic circumcision. Initially, when you think about the concept, it's not entirely apparent what it is or why it's necessary. Circumcisions are performed all over the country, typically by your local general urologist. Some parts of the country without many urologists, you'll have, a primary care doctor trying to do it or general surgeons. Obviously, pediatric circumcisions are an entirely different world, where those tend to be performed by either obstetricians or pediatricians. So, circumcisions are readily available throughout the United States. I think the thing that guys don't realize when they're looking for a circumcision is that the quality of a circumcision is vastly different, depending on who does it, what their goals are, what their techniques are, what their mindset is when they're performing the surgery. Your typical circumcision, so a typical adult circumcision who walks in my door, I see a few things that I think most guys would be a little horrified by, or at least afraid about if they were to see this. Most of the incisions are lumpy and bumpy. Most of them have scars of sort of what I call hypopigmentation, or white scars that almost look like railroad tracks throughout the incision. The decision making about how much skin to take and where to place the incisions is all over the place. So these are obviously performed with a functional goal in mind of removing a guy's foreskin without putting any thought or technique or effort in producing something that looks good. As a man, I could say that I think most guys, and myself included, care what we look like, especially care what our penis looks like. And so someone who has a circumcision that's done for a purely functional reason is really missing out on the entire cosmetic aspect of the surgery. As a urologist, when you train in a urology residency program, it's dominated by men. And despite being a male-dominated profession, this mindset that it doesn't matter what you look like is really prevalent and pushed on in urology residents. And so I think that then sort of shows itself or manifests itself in many ways in the cosmetic outcomes of what we do as urologists. I think this is why you see so many just terrible looking circumcisions out there, because urologists don't care for the most part about what their actual outcomes look like. So when I developed my technique, I was attempting to both address all the shortcomings you see with a standard circumcision, and also try to improve on it in general, really thinking about this as a cosmetic surgery and not just a functional surgery. I have guys coming to me for purely cosmetic reasons or purely preferential reasons, and others coming for medical. But at the end of the day, I think they all deserve something that looks good and something that functions really well. So my overall concept was try to produce something that replicates some of the seamless look of a pediatric circumcision. So you don't have the lumps, you don't have the bumps, you don't have the scarring, but offering this for adult men. So something that looks good and functions well as well. I'm able to achieve this through particular sutures, so using very fine suture technique, smaller sutures, as few sutures as possible, and also really deliberate decision-making in terms of how the incisions are made, where they're placed, in order to avoid some of these complications we talked about. Now, if you look there's some forums out there, so you look on Reddit in particular, and guys will talk about circumcisions, and you'll see a lot of thoughts about preferences in terms of style. Guys will describe a high circumcision, a low circumcision, a loose circumcision, a tight circumcision. These aren't anatomic terms. These aren't medical terms. These are sort of been developed out there in the world. I'll use them now because my patients are all aware of them. I find one of the styles that's most common out there is something called a low and tight circumcision, where the incision is very close to the coronal margin, so really close to the head of the penis, and the skin is very tight, which means you took a large segment of skin when performing the circumcision. A lot of guys like the look of this. They'll comment and be very supportive of each other with this type of circumcision. It has significant drawbacks I think guys need to be aware of. From a functional standpoint, it doesn't feel very good. There's no sliding motion of the skin during sex or masturbation, so that's entirely no longer an option. It also tends to bring up scrotal skin onto the penis, creating a penis scrotal web. And then finally, with a very low circumcision, with the incision by the coronal margin, by the glands, it's very difficult to revise it in the future because there's no residual tissue. So it tends not to be my preferred look. I have a sort of a standard look I go for that I show all my guys in advance. I'm always open to someone's preferences. So if a guy has a particular cosmetic preference, I will work with them within reason. I think the key is just informing them why I have my preferred classic look, why I go for that. But if a guy wants to go, a little looser, a little tighter, lower or higher, I'm always open to helping them out.